Let's listen to an expert doctor for hypertension in young population along with coronary artery disease and higher heart rate. Can be sure of happy heart? Today we have Dr. Kumar, Apollo Hospital, Mysore. Doctor, how do we define hypertension and when should we conclude that the person has hypertension?
We'll call hypertension a silent killer because it doesn't produce any symptoms as such. We'll come to know whether a person is hypertensive or not when we check his or her blood pressure. Normally, the blood pressure should be less than 120 systolic and diastolic should be less than 80. So next level, we call it as something known as elevated hypertension, where BP will be 120 to 129 and diastolic will be less than 80. We usually in clinical practice, we divide hypertension into two stages, stage 1 and stage 2. Stage 1 hypertension, when the blood pressure is between 130 to 139 and diastolic will be 80 to 89. Stage 2, when the blood pressure is more than 140 systolic and more than 90 diastolic. So all patient, irregular of his comorbidities, should have at least once his BP checked up to know whether his blood pressure is normal, whether it is on elevated or it is come into stage 1 or stage 2.
Doctor, can high blood pressure be completely cured?
The usual answer will be no, because it's a lifestyle disease. Many times we can control hypertension, but usually can't be completely cured.
Doctor, what precautions should a patient take along with medicines?
Hypertension is a lifestyle disease. So, a non-communicable lifestyle disease. So, lifestyle modification or leading a healthy lifestyle is far more important other than medications. For example, I'll give a few examples. If he is a smoker, we should encourage him to quit smoking. Alcoholic, of course, reduce alcohol intake. If the person is obese, we'll encourage him to reduce his weight and go for a regular physical activity like simple exercises or walking or swimming. Any type of exercise will definitely going to help not only bringing down hypertension, along with that it will going to improve his cholesterol, improve his diabetic status. If the person is already a diabetic patient, he should keep a watch on in blood sugar level. Of course, diet, we should reduce his salt intake, fried items, and younger generation, especially the one point I want to stress nowadays is to de-stress themselves, because stress is one of the leading factor for young hypertensives, where in India, according to one study, 22 to 25% of people are already under different stress, whatever could be the reason, whether it's economic, social, marital, job, professional, anything could be there. But as an individual, they should learn to de-stress themselves.